All right. Thank you very much. Our next speaker is going to be Dr. Allison Jang. Dr. Jang is our second-year clinical fellow here at UCSF. Many of you know that we have a training program that we share with Kaiser Permanente San Francisco. And Dr. Jang joined us over a year ago. She did her residency at UC Davis, so all part of the UC family, and will be speaking to us on weight management. We know that the obesity epidemic is something that affects gynecologic cancers and health overall. So we wanted to address that with the audience today. Dr. Jang.
Thank you, Dr. Chen. I will share my screen. All right. Perfect. So once again, my name's Allison Jang. I'm one of the clinical fellows here at UCSF, and I'm excited to be speaking to you today about weight management and how it relates to gynecologic cancers. Obviously, weight management is a very wide topic, and so I'm only going to be really scratching the surface today. But I hope that this topic sparks some questions, some discussion, and I've also provided some resources within the PowerPoint. There are many QR codes, and you'll have access to the slides after the program to be able to review those resources on your own. And so first, just for some overview. So first I'll be talking about how we measure weight status, as well as how weight affects cancer and its outcomes, and then reviewing some of the principles of weight management and strategies for implementing some of these principles into your daily life. And as I said, also providing some additional resources for you to review at your leisure. And so first, in terms of measuring weight status, there are a couple of different ways that we evaluate this. In medicine, we know that having a high amount of body fat can cause many related diseases or other health issues. You may have heard of a measure called a body mass index, also known as BMI, which is a more objective screening tool that we use to estimate weight status in relation to potential disease risk. And so BMI is calculated by using a person's weight divided by their height squared. And this QR code is a way for you to access an actual calculator and calculate it yourself. Essentially, when a person's weight is higher than what's considered a healthy weight for their height, this can be described as overweight or obese. And so having a BMI between 25 to 29.9 would be considered overweight, versus having a BMI greater than 30 would be classified as obese. And this can be subdivided into different classes of obesity. And so from now on, when I refer to obesity, that will be referring to a BMI greater than 30. And so within the United States, we know that the prevalence of obesity is increasing from 30% back in 2000 to 41% more recently in 2020. Obesity impacts some groups more than others. This map is of the United States. And so you can see that the darker orange, more red colors indicate areas with a higher prevalence of obesity. And so definitely a higher prevalence within the Midwest and the South. And this is followed by the West Coast, as well as the Northeast. Obesity is a very complex disease. And so there are many factors that can contribute, external factors that can contribute to this. That could be as simple as like a neighborhood design, or access to healthy foods, or access to a safe area for physical activity. But later in the talk, we'll talk about some of the strategies and resources you can use to help achieve your desired weight management goals. And so why do we care about obesity? We know that there are long-term health outcomes associated with this disease that can cause other diseases, diabetes, high blood pressure, or high cholesterol, also heart disease, sleep apnea, arthritis, are just some of the chronic conditions that we see. Also malnutrition. Dr. Sham talked a little bit about nutritional status and its relationship to frailty, and malnutrition commonly exists with chronic diseases as well as actually with obesity. And we know that 20% of our cancer patients, including those that are obese and overweight, will be malnourished at the time that they see us, lacking nutrients such as like vitamin D and biotin, vitamin C. And also cancer in itself can be very demanding to your metabolic system and cause further depletion of these. And in addition, we care because obesity can also affect your cancer treatment. For surgical interventions, we know that there are higher rates of perioperative complications, increased rates of needing to convert from a minimally invasive surgery to an open surgery, and requiring more intensive post-operative care. For chemotherapy, body weight can determine the safety and effective administration for a lot of our chemotherapy agents. In addition, obesity can cause impairment in renal function or kidney function. And as a result, that can affect the dosing and the clearance and toxicities that patients experience with their treatment. And then also radiation. The radiation needs to actually hit the tumor in a very precise manner to be effective. And so with obesity and having an increased distance between the tumor and the skin surface, sometimes they need to do higher doses of radiation, which can also cause toxicity to other organs as a result. And then finally, we also know that having an increased weight can affect cancer outcomes. And this has been seen in many of our gynecologic cancers. Particularly for endometrial cancer, we know that there's a 10 times increased risk of developing endometrial cancer when obesity is present compared to non-obese women. There are higher rates of mortality or death from cervical cancer compared to normal weight counterparts. And in ovarian cancer, there's a 17% greater risk of dying from ovarian cancer compared to patients with a normal weight. And so quickly reviewing some of the mechanisms of how obesity actually increases the risk of developing cancer. We know that obesity increases the risk for not only gynecologic cancers, but also like kidney cancers, thyroid cancer, breast cancer, esophageal cancer, particularly the relationship with gynecologic cancers primarily happens, we think, through these mechanisms, one being hormonal changes. Fatty tissue contains an enzyme that turns steroids in your body into estrogen. And so this can promote the growth of cancers that respond to hormones, particularly some types of uterine cancers or ovarian cancers. Another mechanism is inflammation. Living with obesity is a heightened inflammatory state. And so as a result, this leads to the inhibition of some of the mechanisms that cause abnormal cells to die and also increases cell growth. And so particularly in patients with certain types of cervical cancers, one called adenocarcinoma, it was found that women are twice as likely to be diagnosed with this particular type of cervical cancer when obesity is present. And then finally, this condition can also influence various metabolic pathways. It can cause lots of changes in the metabolism, as you may have heard of the protein called insulin. And so having high levels of insulin or insulin resistance also promotes tumor growth, similarly through stimulating cell proliferation. And so just to review some of the principles of weight management, having a cancer diagnosis can change everything and really shift priorities in terms of focusing on health. And so one of the ways to stay healthy is maintaining a normal body weight. And so that's what we want to help you all promote in your daily lives. And so the first one of the principles is establishing healthy eating habits and reducing the number of daily calories if you are at an increased weight. And so things that can help with this are keeping a food diary and actually counting calories each day to make sure that you are objectively measuring where your intake is. Portion control. Another simple way to help monitor this is to implement something called the plate method, where essentially half of your plate is occupied by non-starchy vegetables, and then the other quarters contain proteins as well as carbohydrates. It is also helpful sometimes to either weigh or measure your food, but I know that can be challenging with daily activities in life, and so the plate method can sometimes be more realistic to integrate into life. Also reducing unplanned eating, avoid drinking calories. So this can be like sodas, juice, also alcoholic beverages like wine or beer are very high in calories. And so instead opting for a 0-calorie drink or just water. And then also avoiding eating after dinner time. And as I think more realistically, if you know that there are high calorie items that you particularly have an affinity for, stopping 1 to 2 of those can make a big difference. Really, a lot of it is controlling your environment, either not bringing these foods home or avoiding eating out. Sometimes people find it helpful to implement a weight management program, such as Weight Watchers, that can help you make just healthier choices. And also they can help manage your caloric intake. Particularly with other chronic health conditions, it's important to talk to your doctor and nutritionist about particular dietary changes that can be helpful. So for hypertension in particular, the DASH diet is commonly recommended, and this focuses on a low salt diet. For diabetes, making sure that you're intaking good carbohydrates, so ones that are not processed, or having a diet that's high in fiber is also a big focus for those measures. The second principle is starting a consistent exercise program. This can be very challenging and also very frustrating, particularly since we know that exercise does not cause quick short-term results. However, we do know that in the long term, this is helpful for maintaining your muscle mass and your strength. In addition, exercise also helps with your mental health, managing diseases like hypertension and diabetes, and also can help control pain. And so a goal to eventually aim for is 5 to 6 days a week, including 2 sessions of weight training. And there are lots of different resources available online that go over recommended physical activities. The WHO has a nice website that's based on age as well as chronic conditions. That makes recommendations for different types of activity. And I'll leave this slide here for reference that you can look at later, in terms of what they say they will classify activity as moderate or vigorous. And so these are some examples of what might be considered moderate or vigorous for individuals when you're looking at those other resources. I think number 3 is probably something that is challenging for a lot of people, but also making sure that you're maintaining your wellness and making yourself a priority. Things like getting adequate sleep and actively managing your stress, getting counseling or other resources as needed are things that are easy to put aside, but really important things for weight management. And then our last principle is finding your support system. This can come in many different forms. So family, friends, coworkers, having an exercise partner, your medical team, so your primary care doctor and endocrinologist, your GYN oncologist, also nutritionists and therapists, and the list goes on for sure. But I think that one thing that we're trying to do here is really increase our education. We know that from large surveys that nearly 60% of patients were not aware that obesity increased the risk of developing conditions like endometrial cancer. And actually in this very large survey over thousands of patients, only 37% reported that their healthcare provider had discussed the relationship between increased weight and gynecologic malignancies. And one of the barriers to this is in terms of our training and education. We know that in terms of gynecologic oncology providers, 40% didn't feel comfortable or adequately prepared to counsel patients on weight loss strategies. And so actually at our institution, last year, we implemented a fellows quality improvement project where our division actually received training from the director of our weight management clinic here on having these discussions. We also created a educational video which talks about the association between obesity and endometrial cancer to start as our focus here. And then we are also offering referrals to patients to partner with the weight management clinic if that's something that they're interested in. And so for our progress, we were able to successfully increase our education. Like I said, we're focusing primarily on endometrial cancer patients, but we went from 0% documented education to 80%, so a pretty decent increase. And then also of the patients who received the education, the majority of them also accepted referrals to the weight management clinic, which is great. And so this is the website for the weight management program here. You can scan this QR code at a later time. And then additional resources quickly. This is an obesity toolkit from the Society of Gynecologic Oncologists that you can use this QR code here to access that toolkit. Also, the CDC has lots of great resources, fact sheets, also other prevention strategies, more specific information on diet and nutritious foods. And those were all of my slides. I'm happy to take any questions.